Hello, I'm Dr. Fox. Today, I would like to talk about sex and aging women's issues. So first of all, what changes might older women see in their bodies and sex lives? Everyone's body changes as they get older. Both women and men go through hormonal changes in middle age, and it's normal to have a little difficulty adjusting. Some may worry that their sex life is coming to an end or that they are no longer attractive, but it is completely normal for middle-aged and older people to be sexually active. In fact, for some women, this is a very liberating period. Many menopause and postmenopausal women actually find that they are having better sex as long as they can talk properly to their partner about the fact that their sexual needs are changing. Then, what effect does the menopause have? The changes in your body are mainly due to lower levels of prostaglandin and estrogen. These include periods becoming erotic and then stopping, commonly accompanied by night sweats, hot flushes, and difficulty sleeping, and sometimes by a loss of libido and lack of lubrication in the vagina. If this is your case, you are finding sex painful, try using lubricants, moisturizers, or estrogen tablets, creams, or pessaries. Okay, next. Is there an age limit on women having sex? My answer is no. Older people's sex lives are not discussed as much as younger people's, so some assume that they lose interest in sex. This is not usually true. Sex may be different, but that doesn't mean it's less meaningful or enjoyable. As people tend to live longer than they used to, their sex lives tend to last longer as well, and that goes for women as well as men. In fact, research suggests that over 50% of women aged 50 and over have satisfactory sex lives. Women may find that it takes longer to become aroused, but they also find that not having to worry about getting pregnant or the demands of childcare makes them more relaxed and able to enjoy sex more. Most older women, especially if they remain sexually active, can have normal orgasms. However, you may find that the vaginal area and breast are less sensitive to your partner's touch. It takes longer to get to orgasm and you need different types of stimulation. Tell your partner so he can help you enjoy sex. Okay, next. What if you are ill? Illness can certainly have an effect on sex, and older people are more likely to experience disabling conditions and illnesses that may impact their sex activity. For example, arthritis, stroke, coronary disease, diabetes, and Parkinson's all affect sexual responses as the surgery and the side effects of some medications. Illness can also have a psychological effect. If you or your partner has been diagnosed with a life-threatening or life-limiting illness, in particular, you may find it changes your or his self-esteem or body image. Likewise, if one of you becomes the carer for the other, it brings a change into the nature of your relationship, which may have an effect on how you relate to each other sexually. You can talk to your doctor about all these matters, and if they cannot help, they can put you in touch with a sex therapist. Then, what is a sex therapist? A sex therapist specializes in assessing and treating sexual and relationship problems for individuals or couples. This is talking therapy, so there are no medicines or operations involved. The therapist will discuss your issues with you, identify factors that may trigger them, and put together a treatment program. Sex therapy can not only be very effective in resolving sexual difficulties, but also helps people develop healthier attitudes towards sex and improve their sexual and intimate relationship with your partner. It may be available to you through your doctor, or you can go private. Always check the therapist is qualified and registered. Okay, next question. Can postmenopausal women get sexually transmitted infections or STIs? My answer is yes. The menopause is no protection against STIs. In fact, the number of people with STIs is increasing in all age groups. You need to take the same precautions as when you are younger. Use a condom with a new partner and seek help immediately if you spot any worrying signs. Okay, next. What if you are embarrassed to ask for help with STIs or something else? My answer is don't be. The doctor and all the other medical staff you will see are completely used to dealing with these issues. Older people, in particular, sometimes find it difficult to talk about sex, but remember, all the sexual health services used by young people are also there to help you. Just because it is not talked about so much does not mean that middle-aged and older people stop having sex or needing help from sexual health workers. Also remember that communication with your partner is key to know what you both enjoy. Okay, thank you for watching. See you soon.